So good evening, everybody, and it's a great pleasure for me to be here presenting this Hatvet webinar series on small animal gynecology. And and I'm very glad to also be a part of the Small Animal Practitioners Association of Gurugram. And I really, appreciate the efforts taken by them and Dr. Rajneesh Tyagi for carrying out this webinar series. Yeah, though I'm late in this sessions, right? Okay, so I joined very late in these presentations. Yeah, and of course that was for my personal reasons. And as Dr. Rajneesh said, I'll be doing a five-part series program in this series. And the first being on canine breeding management. It's all in the timing and understanding of reproductive physiology. It's kind of funny why I added these two lines in my sentence, right? It's all in the timing and understanding of reproductive physiology. Because I could have just said canine breeding management, yeah? But the reason why I did this is like, in my 25 years of service, I've kind of, a lot of time I've seen clients coming to me saying, Doctor, I've tried mating my dog several times, she didn't conceive. And then people said that if I bring it to you and my dog is going to conceive. And it's funny because I'm not doing any magic, and I'm not a person who's working on assisted reproductive technology so that I'm getting involved into it and my hands are there to bring about a conception. No, it's not like that. It's just that I have a better understanding of the reproductive physiology and I'm trying to give a solution to your client or to my client in a more scientific manner. So that's why for the next 90 minutes or so, I would be taking you through the clinical reproductive physiology. My focus is going to be on proestrus and estrus, or the major events that are associated with breeding. And I also will be taking you through sexual behavior and hormonal changes during these two stages. And I will walk you through the sequence of events that are associated with ovulation, because this is a very important part where you need to understand how breeding works. And this is also going to be the basis for you to understand how pregnancy and parturition also works. Okay. So that I'll also try to talk about some of the errors in breeding management and also the breeding management tools that are available and which tool to use under what situation. So here I would like to give you almost a case-based situation. I will take you through this using a case-based situation, and we will try to kind of attend to that case based on your the advantages and disadvantages of the various techniques that I'm talking about. And finally, I would like to close with ovulation timing and optimizing conception in bitches. Before I go on to the cycle or the basics, there are two things that I really need to address. Why or when does a dog attain puberty, or when does she show her first signs, right? Okay. And the second thing is, how often does a dog cycle? Okay. Now these are two common questions that people keep asking us, talking to us, asking us. So sometimes recently I had a client saying, Doctor, I have two dogs with me. One dog came into heat at 6 months, and now it's almost 18 months. My other dog has not yet shown signs. So you need to understand that onset of puberty can happen as early as 6 months, and it can go even as late as 24 months of age also. It's perfectly normal, okay? So with smaller breeds attaining puberty at 6 to 10 months of age, and larger breeds attaining puberty at 18 to 24 months of age. So that means up to 2.5 to 3 years, I'm not going to be really worried about it at all. And I'm not going to do anything that is going to induce an estrus cycle in a dog which is not showing heat signs at all. So that means all infertility evaluations in most breeds should be delayed until they are 24 to 30 months of age. Okay. So now how often does my dog cycle? Okay. So that means I'm talking about the inter-estrus interval, the interval between two estrus cycles. Okay. So now this on an average, okay. So before this, actually, we normally say dogs are supposed to be seasonally monoestrus animals. That means they come into heat only once a year, and that too in a particular season. That's by the definition, right? But it's not actually so. We find dogs coming into heat almost all the year around, except for a particular breed called the Basenji. Now, this Basenji dog comes into heat only once a year, and that too in a particular season. But otherwise, almost dogs come into heat almost all the year around. So there's no particular seasonality associated with their occurrence of the cycle. Okay. So now these are the interestrus intervals. Okay. Now this ranges from, on an average, it's around 6 months, but it can range anywhere between 5 to 11 months, with smaller dogs having an interval of 4 months between two heat periods, when larger dogs having an interval of nearly 12 months between the heat cycles. So anything less than 4 or more than 12 is going to be worrisome. Okay. Till then, I'm not really going to be bothered. Okay. So somebody comes to you saying, Yes, my dog is cycling every once in 2.5 months, then that's a problem, right? And that's associated with infertility. And somebody says, doctor, it's almost nearly 13 months or more than 12 months, 13 months, my dog has not come into heat. Okay, now that's a problem associated with infertility. So there I would intervene. Otherwise, normally anything between 4 to 12 months is perfectly normal. Okay. You also need to consider certain breed variations. For example, you have the German Shepherds and the Rottweilers. Now, though they come into the category of the large breeds, now these breeds cycle once in every 4 to 4.5 months, which is perfectly normal for that particular breed. And similarly, a Basenji dog cycles only once a year and that in a particular season. So you need to think about breed when you're talking about the occurrence of the cycle. Okay, so let's go on to the canine estrus cycle. Now, dogs are very unique in that they have the longest estrus cycle when you compare to any other species. And again, each stage of the cycle is also very long when you compare to any other species. Okay, so now most important thing is this dog. Okay, so that means when you talk about stages, you have proestrus, estrus, diestrus, and anestrus. So you see something here, anestrus. So anestrus you don't see in most of our domestic animals, okay? So here anestrus in the case of canines is a normal part of the estrus cycle, okay? And here a dog which is going to be in heat, if I'm going to breed her and she becomes pregnant, she enters into a period of pregnancy. And if she does not become pregnant, she enters into a period of diestrus. But what's peculiar is that all dogs after pregnancy or after diestrus have to enter into a definite period of anestrus. So anestrus becomes a normal part of the estrus cycle. Okay. So since I'm going to talk about breeding management and so my focus is totally going to be on proestrus and estrus, whereas the rest of the stages will be covered in my next series of seminar, which is going to be on pregnancy and parturition. Okay, so we'll be talking about proestrus and estrus. So proestrus, we all know it begins with appearance of vaginal bleeding or spotting. The very first day I see this vaginal bleeding or spotting, then I say this dog has entered into a proestrus. Now, this duration is going to be on an average 9 days. Okay. But what I want you to remember, see, as a veterinarian, okay, forget about breeders, forget about what they think. As a veterinarian, you need to understand that this proestrus can range anywhere between 0 to 2 days to even as long as 25 days. That means a dog without having a proestrus can enter into an estrus, or she can have a proestrus of nearly 25 days and she can enter into an estrus on the 26th day. Okay, so that means every dog, all these dogs are perfectly normal, except that they are varying from the so-called average of 9 days. Okay, so during proestrus, the vulva is swollen, edematous, and it's warm and hot to touch. So we use the word colloquial term, the bitch is in heat. Okay, and this bitch is going to be very attractive via signaling pheromones in the urine and vaginal secretion. So you find this bitch in heat is constantly kind of passing small amounts of urine everywhere, and this is actually she's actually sending out pheromones which is signaling her or her that she's in heat. Okay, so now for easy understanding, now I'm going to talk about the sexual behavior that is associated with proestrus. Now I know as veterinarians you know all this, but again it's an important part because when you're trying to advise your client to breed a dog based on sexual behavior, an understanding of this is very, very important. Okay, so for easy understanding, let me take a dog, or I'm kind of going to kind of divide this proestrus into early, mid, and late. Okay. So during early proestrus, this male dog, when he's trying to mate the female. Okay. Now here you need to also understand that male will be ready to mount the female right from day one of proestrus. Okay. Now it is only the behavior of the female that we're really focusing on. So what happens is during early proestrus, this bitch will be very aggressive to male dog. She'll refuse all mating attempts by trying to turn, bite, or snarling, showing her teeth, right? Okay. So her kind of behavior during early proestrus will be highly aggressive. Now, as this dog is moving from early to mid to late proestrus, her aggressiveness gradually gets replaced by submissiveness. So during mid proestrus, now what she would do is when the male is trying to mount her, she may not be very aggressive, but probably she will not allow him and she will sit down or she'll cover her perineal region with the tail. Now, during late proestrus, she may go and invite the male to mate her, but when the male tries to mount her, probably she will lie down. She will lie down on her back. She will probably cover her perineal region with the tail. But very few dogs during late proestrus, they may be very submissive. Or in fact, submissive female dogs during late proestrus may allow the male to mount. in general, pro-estrus, during pro-estrus, the female does not allow the male to mount and breed. Okay. So estrus begins with the first acceptance of the male and ends with the first refusal of the male. Now, this is very important because when I'm trying to talk to the owner or when I'm trying to advise a client for breeding based on sexual receptivity or breeding based on cytology, it's very important because I keep telling them go on breeding the dog until refusal. Now, until refusal indicates end of estrus and the beginning of diestrus period. Okay, so this is very important. So this duration on an average can be 9 days. Here too, it ranges from as short as 2 days to as long as 18 to 20 days. So giving you this data, if I'm going to put this proestrus and estrus together, that means this duration of proestrum and estrum can go anywhere between 45 days to, I mean, as short as 4 days to as long as even 45 days. Okay. So now during estrus, as I told you, this is the period of sexual receptivity, and there would be flagging of the tail. So you can see the tail actually when you touch the perineal region, you find this, there's going to be a deviation of the tail, and there would be kind of an arching of its back. It's called as raising its hindquarters, mild. You don't see a lordosis as you see in a cat, but still there could be an lordosis lip flex, which you see in the case of dogs. Okay. Now on my right side, you see a series of kind of pictures that is going to, that is depicting the act of copulation in the case of dogs. Okay, and where you see this mounting, you see the turn, and you see the classical back-to-back position. Okay, so what's so peculiar about this? So I'm going to take you a little bit away from this estrum to a little bit about of the unique features of the copulatory act in the case of canines. Okay, so here you know about the. I mean, when you describe the penis in the case of canines, it consists of two portions: the pars longa glandis and you have the bulbus glandis. Okay, so this is an erect penis, right? What you're saying is an erect penis, but normally when the penis is going to be flaccid, this bulbus glandis is not swollen, right? So it's kind of like, yeah, it's also flaccid in nature. But once the penis becomes erect, the bulbus glandis swells, okay? And this is the contributing factor for what is called as a coital lock or the tie. Now you see here, you have a penile bone here. Now this is very, very unique in the case of canines, right? You have a penile bone which is surrounding the urethra. And this penile bone, or we also call it as a baculum, right? And this is a kind of an evolutionary puzzle. So there are two explanatory reasons why there should be a penile bone in the case of canines, okay? So they say that probably this baculum helps male to breed for extended periods of time. And that, I mean, it's present in those species where the coitus is actually very prolonged. And this prolonged intromission hypothesis, okay, we say this is a prolonged intromission hypothesis. And here, the penile bone has been evolved to protect the urethra. So the urethra is the tube that is responsible for delivering the sperm. So it protects the urethra when the sex becomes a lengthy endeavor, right? So that's probably one of the reasons why you have a penile bone in dogs. Okay. Now the second possible reason for a penile bone, I mean, see this is again I my guesswork. I really don't know. Books don't give you an information on this, but maybe this could be the reason. So we all know that when there is going to be, okay, let's take this way. Any sequence of copulation for any male species for that matter, you need to have what is called the sequence involves erection, then you have an intromission, then you have an ejaculation, and then you have a dismount. So that means for a penetration to take place, the penile penetration to happen, the penis needs to be erect. But what happens in the case of canines is that once the penis becomes erect, the bulbus glandis will swell. Okay. So now that means once the bulbus glandis swells outside, it is impossible for the penis to penetrate. Now this is what we call that as an outside tie, right? So a lot of times we've had ejaculations with an outside tie happening. That means the tie does not happen within the vagina of the bitch; it happens outside, right? Okay. So now for an intromission to happen, I need an erect penis. Okay. But problem is if the penis becomes erect, then the bulbus glandis swells. So what happens in the case of canines is that there is only going to be a partial erection and the rigidity to the penis is going to be provided by the os penis. Once penetration happens, then there is going to be a bulbus glandis. The bulbus glandis enlarges and this results in what is called as a coital lock or a tie. So this coital lock consists of three stages. The first stage is going to be, 1 to 2 minutes. Then you have the turn, and then you have what is called as a classical back-to-back position, right? Okay. So now this classical back-to-back position, why I'm talking about this is that the peculiarity is that penis is also capable of 180-degree rotation, which is very, very unique to the species. Okay. So now let me go back to where I left. So we were talking about estrus, right? Estrus period. So we're also going to talk about some of the hormonal events that are associated with proestrus and estrus. Now, this is again very important when I'm trying to breed a dog based on hormonal assays. So for easy understanding, let me take a dog with 9 days of proestrus and 9 days of estrus. I call this bitch as an average bitch. Let's say what's happening in this average bitch and kind of like think about the other dogs that deviate from this so-called average, right? So during proestrus, you have follicles that are there. These follicles are producing estrogen. So estrogen, you find this green line here. This is going on increasing. And during late proestrus, it reaches peak levels of nearly 60 to 80 picograms, after which the estrogen level begins to decrease and comes to basal level with the onset of diestrus. Okay?
Hatvet Pharma introduces Hatvet tablets. Vitamin A 2500 IU, Vitamin D 1000 IU, Vitamin E 25 mg, Selenium 30 mcg, Zinc 20 mg, and Biotin 50 mg. Powerful skin nutrition with the power of zinc. Vitamin A, E, D, Zinc, Selenium, and Biotin tablets, Hatvet tablets. Indications: maintaining healthy skin and coat, dry or dull coat, improving rough coat, reducing shedding dry skin and dandruff, improving immunity of skin, hair loss, show animals zinc responsive dermatosis. Dosage for puppies and kittens, half to 1 tablet daily. For dogs less than 10 kg, 1 tablet daily. For dogs greater than 10 kg, 2 tablets daily. Route oral. Presentation 1 into 10 tablets. You can book your order online at www.hatvet.com. Looking forward to a long-lasting business association. Thank you.
So now what's very peculiar in canines is that there is an increase in progesterone levels. You see this blue line here? There is an increase in progesterone levels starting from around, during the late proestrus, beginning around this time, during the late proestrus. So usually, where is the source of progesterone? Any species you take, the source of progesterone comes from the corpus luteum. And when does the corpus luteum form? After ovulation. But in the case of canines, even before ovulation is happening, the follicles begin to produce progesterone. Okay, so these follicles undergo what is called as partial luteinization, and the partially luteinized follicles are beginning to produce progesterone. So that means in any species, estrus will be exhibited only with peak estrogen levels. But in the case of canines, what's happening is estrus is exhibited with decreasing estrogen and increasing progesterone levels. So this is again a very unique feature that happens in the case of canines. And this decreasing estrogen and increasing progesterone is a triggering factor for standing estrus to happen, for LH surge to take place, and subsequently ovulation to take place. Okay, so that means this is a triggering event for the other major events to happen, which is associated with, the ovulation, fertilization, and consumption. Okay, so now, okay, I'll also talk this. So that means clinically. So my take-home message from this slide is that clinically, I can use this progesterone levels to actually tell when the LH surge is happening and when ovulation is happening and when fertilization is going to be happening. Okay, so we'll be talking about this later. Now, I'm also going to take you through the sequence of events that are associated with ovulation. Again, for easy understanding, I'm going to take an example of a dog with 9 days of proestrus and 9 days of estrus. So let's say on the ninth day, this dog is entering into her estrus. On the 10th day, you have what is called as an LH surge. Okay. Now, this LH surge is the hormone that is responsible for ovulation. And it doesn't always have to happen one day after the estrus. It can happen 3 days before the onset of estrus, on the day of estrus, or even 3 days after the onset of estrus also. So, as an example, let's say this happens on the 10th day. Okay. So now what happens is ovulations normally happen 24 to 48 hours after the LH surge, and it happens over a span of 4 days. So that means on the 12th, 13th, 14th, and 15th. So eggs are coming out. So for example, let's say I'm just giving, see, all this is just an example for you to make you understand that what could possibly go on, right? So now let's say on the 12th, you have 4 eggs that are coming out. On the 13th, you have 3. On the 14th, you have 3. Again, on the 15th, you have 2 eggs. Now, what's very peculiar is that at the time of ovulation, these eggs are only primary oocytes and they're not fit for fertilization. Now, in the case of, canines and equines, these are only 2 species where ovulation happens and these eggs are only primary oocytes at the time of ovulation. In all other species, they're secondary oocytes at the time of ovulation. So here what happens is these eggs, it takes another 2 more days for them to become mature and fertile. So that means these 4 eggs which ovulated on the 12th, they are becoming secondary oocytes on the 14th. So once they mature and become secondary oocytes on the 14th, they can survive only for 24 hours, after which they would degenerate. So that means these 4 eggs are alive only up to day 15, after which they will disappear. And now these 3 eggs are ready on the 15th, they will be available to day 16. The 3 eggs on 14th, they are available at day 16th, and they will be at, see, it goes on like that. So the last 2 eggs will mature on day 17 and will be available up to day 18. So when you're talking about events, okay, estrus is a separate event, LH surge is a separate event, ovulation is separate, fertilization is separate. You need to very clearly understand day of estrus is different from fertilization, LH surge is different from the day of fertilization, ovulation is different from the day of fertilization. Okay. So when I'm going to do a breeding management protocol, or I'm going to advise my client on to, how to breed a dog, it's very important that the breeding management tool that I'm going to use, what event it's going to identify. Whether I'm using it to identify estrus, or I'm going to use it to identify LH surge, or I'm going to use it to identify ovulation, or I'm going to use fertilization. Okay, my strategy is going to vary depending upon the event that I'm trying to identify. For example, let's say, if I'm going to use a tool that identifies the LH surge, then I will breed the dog 4 days later. Am I right? Because 2 days later is only ovulation, and only after 2 days the eggs are ready for fertilization. So if I identify the LH surge, I will breed the dog 4 days later. If I identify ovulation, I will breed the dog 2 days later. If I identify fertilization, I will breed the dog immediately. So that means, again, this is a very important fact that I need to keep in mind, because again, the event I'm trying to identify. Okay. So now I'm also giving you another data, because when we talk about sperm survival in the female reproductive tract, right? Okay. This is also very unique in the case of canines, is that the sperms can survive for a minimum of 4 to nearly 7 to 11 days in the female tract. Okay. Now, having spoke to you about all this in this particular slide. Okay. Now, this dog, this is an average bitch. Average bitch means 9 days of proestrus and 9 days of estrus. Okay. Now, this dog, if I'm going to breed her on 9, 11, and 13, my question is, will she conceive or not? Now, definitely, see, this is normally a question when I have a live audience with me. I put the question, I wait for the answers, and I kind of interact with them, right? But here it's more of a virtual audience, and I would say, yeah, this dog will definitely conceive, because imagine that I'm doing a mating on 9, 11, and 13, and the sperms are going to be available to fertilize all these eggs. Okay, so 100% this dog is going to conceive. But what happens if this dog is deviating from this so-called average? Okay, so suppose, let's say this dog could have a prolonged proestrum or a very short proestrum. So let me give you an example. Let's say this dog is having a proestrus of 18 days. Okay, now I'm breeding her on the, so this dog is entering her estrus on the 19th day. She has an LH surge on the 20th. Ovulation starts from 22, and fertilization is going to start from 24 onwards. Okay, now this dog, if I'm going to breed her on 9, 11, and 13, and giving that the sperms are capable of surviving for a minimum of 4 to a maximum of 11 days, by the time these eggs are ready for fertilization, you don't have any sperms available at all. Okay, so this is a classical example of an unsuccessful breeding and failed pregnancies in the case of canines. Okay, so let's take another example, a very short proestrus. Okay, so let's say this dog is entering her estrus on the 2nd day itself. Then she has an LH surge on the 3rd, ovulation starts on the 5th, fertilization is going to start on the 7th. Okay, so now when you're going to breed her, let's say you're breeding her on the 11th, 12th, and 13th. That means she's already entered into her diestrus period. Okay. So you may be asking me this question: how can I breed a dog in diestrus? So let's honestly, a lot of times what they do is breeders do is they just take the female to the male, tie them out to the female, and start breeding her, not really knowing that she's entered into her estrus, whether she's ready. They don't do all that. So let's say that this is an example of such a dog, and you breed her on 9, 11, and 13. So by the time what happens, there are no eggs at all available. So this is also a classical example of an unsuccessful breeding and failed pregnancies in dogs. So at this point, I would like to say 90% of the so-called apparent infertility in canine is only because of mistimed matings. We attribute only 10% we attribute to other causes of infertility. So 90% is only because of mismanagement, mistimed matings, or wrong time of matings. Okay. So that is the reason why we kind of focus more on breeding management tools and its protocols. Okay. So there will also be a lot of times clients would come to you and say, doctor, last time she delivered around 13 puppies, but this time she gave birth only to one or two puppies. So is there a problem with her? So though there could be genetics that play a role in that, you need to clearly understand that too early a mating or too late a mating is also be a major contributing factor for low litter sizes. So again an example. So let's say this dog is entering her estrus on the second. So third is her LH surge, fifth is ovulation, and seventh is fertilization. So let's say you start breeding her on the ninth day, but by the time what happens, you have very few eggs that are available because the fertilization period has already started from seventh itself, right? So by ninth or 10th, you may have very few eggs that are available. And that is the reason why I said too early or too late a mating will also be a contributing factor for low litter sizes. Okay, so with this, as I told you before, 90% of the so-called apparent, I use the word apparent, it's not a real case of infertility, okay? Because as a person who is working in canine reproductive practice, this is a major problem that I face. Doctor, my dog is not becoming pregnant. I made it a couple of times, she didn't become pregnant. So that's the reason why I use the word apparent infertility. 90% is because of mistimed matings. The remaining 10% is because of lack of fertilization or embryonic or fetal resorption. So we'll talk about this at the later stages. But here, most important is going to be your breeding management. Okay. So before we go on to the breeding management tools, let's look at some of the errors in breeding management, mistakes people commit during the breeding management practices. Okay. So the first and foremost, as I already mentioned to you before, discussed with you, use of predetermined dates. Most of them assume or in fact, most of us assume that all dogs have a proestrus of 9 days and estrus of 9 days. And so you breed them on 9, 11, 13 or 9, 12, 13. So everything is going to be centered around this 9, 11, and 13. So most important is that no two dogs are same, no two cycles within the same dog is same. So it's very important that we need to understand this. Okay. Now the second common error we do is that restricting the number of matings. I've had a lot of male dog clients, owners telling, oh, Dr. Saab, my male is a champion. He can one single mating, he knows how to do it, and he will go and mate with the female, right? Okay. And it's definitely going to be a conception. And if this female doesn't conceive, then probably then the blame is on the female because they say, okay, there's something wrong with your female, please check your female. Okay. The most important thing is never restrict the number of matings. Give as many matings as possible during the period of estrus. Okay. As many matings as possible during the period of estrus will always help in improving the conception rate. But given a situation where you want to restrict the number of matings, then you need to use other protocols that help in reducing the number of mating chances. But in general, increasing the number of or giving as much as matings will always help in improving the conception rate. Okay. Now, color of vaginal discharge. A lot of time people, during proestrus, the discharge will be bloody in nature. As the dog moves from proestrus to estrus, the discharge becomes much more serous straw-colored discharge. So people actually look for this change in the color of the discharge and they start breeding the dog. Okay. But you need to understand that some dogs will never bleed at all. Okay. Not even a drop of bleeding, but there will be very good estrus, where some dogs will bleed throughout proestrus, estrus, and even into diestrus also. Okay. So never use. So you'll be waiting for the color to change by the time the dog will already be out of heat. So never use the color of vaginal discharge as a tool to determine the date of mating. Okay. Now, behavior of the male also. So a lot of times people come to you saying, doctor, I took my female to the male. Male was ready to mount, but the female did not allow at all. So you need to clearly understand Never use the male to choose the breeding date. We are only looking for sexual receptivity in the female, not in the male. Okay. So never use the male to choose the breeding date. It's always the female that is kept in mind when you're trying to choose the breeding dates. Okay. And the last and important thing is assuming that the male is fertile. Okay. So now this is also something which we have come across because they say, oh doctor, my dog, he always produces. He produced last time he produced around 6 months back, and I'm sure he's fertile. So we have seen a day-to-day variation in the semen sample that's been happening. Okay. So last week the sample will be excellent. This week the sample will be poor. So we need to understand that the sperm that you see today is actually beginning to form 60 days before. So whatever insult or whatever is happening 60 days before gets reflected on the sample that you see today. So that's the reason why we say there is a day-to-day variation in the semen sample. So if you have an infertility case, it's always good that you evaluate the male first, check out that he's okay, and then embark on an infertility diagnosis with the female. Okay, so having gone through the errors in breeding management, let's go on to the breeding management tools. So I would take you through breeding management through this section using a case-based presentation. Okay, so you are presented with a 3-year-old boxer bitch Sandy in heat since 3 days. So history revealed that she had failed to conceive the previous 2 cycles, and in both the cycles, matings were done based on predetermined dates. So further history shows that the male dog is located in Bombay, right? So that means let's assume that the female is located in Chennai. So I'm talking about a dog which is located in my place, and the female dog owner wants to go to Bombay for mating. So the male is located in Bombay, and the male dog owner is willing to give only 2 matings. So given these options, which 2 breeding dates would you suggest for Sandy, and what breeding strategy would you adopt? So this is a simple case where you have 2 things in mind, right? So the location of the male. So male is nowhere near here. I need to transport the female to Bombay, right? So I need to give the owner a time to transport the female to Bombay. And I also make sure, and there is only 2 mating dates, which will result in an assured conception. Okay. So these 2 things are going to be in my mind when I'm trying to go through the breeding management tools, and let's see whether we can apply it onto our case. So there are different methods of breeding. So first one is breeding based on sexual behavior, breeding based on vaginal exfoliative cytology, breeding based on vaginoscopy, and breeding based on hormone assays. So in whatever tool that you're going to choose, okay, your goal in breeding is to have sperms continuously in the reproductive tract whenever ovulation is going to take place. So that's going to be your single main goal. Okay. So whenever ovulation happens, I don't know. See, because I already told you, you need to identify ovulation, you need to identify all this, but don't worry about all that. If you're going to look at this goal on the whole, you know that I'm going to have sperms continuously in the tract whenever ovulation is going to take place. That's very important, and that's enough to bring about 100% conception. So let's look at the first technique, which is breeding based on sexual behavior. So what we do here is that we are starting from day 5 of proestral bleeding. Okay, starting from day 5, I take the female to the male. I always take the female to the male. I don't bring the male because males are supposed to be territorial markers. And if I'm going to take this male to a new surrounding, he may be more interested in his territory rather on the female. So always take the female to the male, okay? And look for sexual receptivity in the female. Just observe them for 5 minutes. See what the female is doing, okay? And how she is reacting to mounting attempts by the male, okay? And if she doesn't allow the male, bring her back. Take her again after 2 more days. That means if I'm taking her on the 5th day, 6th, 7th, then take her again on the 8th day. Not on the 9th, 10th, take her again on the 11th day. So keep doing this, right? Every once in 2 days. The day she accepts the male, right? The very first day she accepts a male, that means estrus has started, okay? And you there again, that means this dog has entered into a estrum.
Hatvet PHARMA introduces Hatvet DS serum, amoxicillin 400 mg, potassium chlorinated 57 mg per 5 ml, bacterial aminopenicillin with beta-lactamase inhibitor with extended spectrum of antibacterial activity. Amoxicillin and potassium chlorinated oral suspension, Hatvet DS, potentiated aminopenicillin systemic drug. Indications: broad spectrum antibiotic for bacterial infections, skin, soft tissue and UTI infections. Dosage for dogs 13.75 mg per kg for every 12 hours. For cats 62.5 mg per cat every 12 hours. Route oral. Presentation 30 ml. You can book your order online at www.hatvet.com. Looking forward to a long-lasting business association. Thank you.
Now, what is going to be your breeding strategy here? See, you need to again remember the event you're identified. You're identified only eastrum. You do not know what is going to be the length of estrus. You do not know when ovulation is going to take place. So, what is your strategy here? Is I remember I told you you need to have sperms continuously in the tract whenever ovulation is going to take place. So, what I do here is that so the day she accepts a male, I start breeding her. I go on breeding her once in every 4 days until refusal. That means every fourth day I'm going to breed her until refusal. Why every fourth day? Why not on alternate days? So you need to understand, given the chances, I need to optimize the consumption. So I need to make sure that sperms are always available. And I also told you that these sperms can be alive for a minimum of 4 days to a maximum of maybe 7 to 11 days in the tract. Okay. So that means what I'm going to do is keep breeding the dog once in every 4 days until refusal. 100% this dog is going to conceive. There is no way this dog is going to fail to conceive unless and otherwise she has failed to ovulate or there is a problem with the male. Okay. Now, the advantage of this technique is inexpensive, no special tools are required. The disadvantage with this is that you need to have a male to assess the sexual receptivity with your female. Okay. So sometimes people say, Doctor, my male is located so far, I can't keep going to the male, checking it, I can't go to Bombay and do all this. So what else can I do? I said, you just need to look for sexual receptivity. You can have a boxer male or a Great Dane, so boxer female or a Great Dane female, it doesn't matter. And I can have a Chihuahua male. All I need to know is whether their female is standing for your male. Just show that. And once she does that, then probably you can actually start breeding her, right? But, and then again, the most another problem that you'll face or a disadvantage with this technique is that some dominant females will never allow the submissive males to mount and breed. Okay. So being a dominant female, she'll not allow the male. So you'll be thinking that she's not ready. She's not ready. By the time she may go out of heat. Okay. And some females may have what is called as male preference. She may not be interested in the male that you're trying to arrange for her. Okay. But she'll be probably interested in some street dog which is located near a gate. She goes stand near the gate, but she may not be interested in the male that you're trying to mate her with. Okay. So there again, these are reasons where there could be a failure when you're trying to breed a dog based on sexual receptivity. Okay. So now does this technique apply to our dog? Definitely it is not possible. Okay. Now, when do I use this breeding management protocol? I use this when there is a clear or a very easy access to a male, or the owner has both the female and the male with him. See, a lot of times, it's very funny. The male, the client, your client has both the female and the male with them, but still what they will do is breed them on 9, 11, and 30 and then keep them separately, right? So there again, please understand, this is not going to work for such dogs. So when you have an easy access to the male, or when multiple matings are possible, now this is a technique that's easy. I cannot go to Bombay, I cannot mate. Let's say this dog is having an estrus period of 20 days. I cannot be in Bombay for 20 days. I cannot give 5 matings or 3. So this does not work for our case, right? So let's look at the second technique, that is breeding based on cytology. So what do we do here is we take vaginal smear. So I have a cotton swab. I introduce into the vagina in a cranio-dorsal direction. I go deep into the vagina and then I do one rotation clockwise, one rotation anti-clockwise, take it out. So when I'm going to introduce the swab, I make sure that I don't touch the clitoral fossa, okay? So this is a very important part when you need to talk about cytology, because clitoral fossa is always going to contain conified cells. So if I touch the clitoral fossa and I'm going to go, I'll pick up conified cells, which is going to interfere with my interpretation, right? So make sure when I take it out also, I don't touch the clitoral fossa, take it out, roll it gently on a slide, and then stain the slide and examine it under a microscope. So stains, any stain, Diffwick or Leishman's or your methylene blue or any of these stains you can use, easy, and you just examine it under a microscope. Okay. So in a smear, vaginal smear, you see that cell types, you have almost nearly 5 cell types that you can see actually. So you have parabasal cell, you have intermediate cells, you have superficial, intermediate, superficial, and cornified cells. Okay. So in a smear, I could see probably all the cell types. The proportion of the cells is going to determine the stage of the cycle. Okay. For example, during proestrus, when the bitch is in proestrus, I will be predominantly seeing these three cell types. Okay. So there would be predominantly more of superficial intermediate, a couple of intermediate, and parabasal cells. Okay. Now, as this dog is moving from proestrum to estrum, I say estrus, psychological estrus begins when the smear has more than 80% of superficial and cornified cells. Both this put together should be 80%. So what we do here is every, starting from fifth day, I collect a smear. Then again, once in every 2 days, I keep collecting the smears and examining them. Okay. And the day the smear shows more than 80% of superficial and cornified cells, then I say this dog has entered into estrus. Okay. So let's look at an example like this here. So on day 5, I take a smear. I have intermediate cells. I have predominantly superficial intermediate cells. So this is a clear case of an early proestrus. So now again on day 8, I take another smear, and there's a slight progression. I have more number of superficial intermediate cells. So this is supposed to be mid proestrus. Now day 11, I see more number of superficial intermediate. This is going in for late proestrus. And by day 14, I start to see the superficial cells, predominantly more than 80% of superficial cells, indicating that this dog has entered into cytological estrus. Okay. So now what happens to my breeding strategy, right? So once again, the event you're identified here is only estrum. You still do not know what is the duration of estrus. Okay. You still do not know when ovulation is going to take place. So here too, what I do is I give multiple breedings throughout the period of standing estrus. Breed once in every fourth day until refusal. 100% this dog is also going to conceive. Okay. So there's no way that this dog is going to fail to conceive. Only thing is you require multiple matings. Okay. So now does this work for our dog? No, this also doesn't work for our dog, because once again, as far as cytology is concerned, as far as breeding behavior, breeding based on sexual behavior is concerned, you require multiple matings throughout the period of standing estrum. Okay. So this is also not going to work for our dog. So let's see another alternative, which is going to be ovulation timing protocols. Now, this is an aid to modern breeding management where I'm going to change my goal a little bit. Okay. So though I'm more focused on having sperms at the time of ovulation, my goal is also narrowed down to identify a very, very important event, that is going to be the LH surge. We all know LH surge is the hormone that is responsible for ovulation, right? So my focus is going to be on identifying the LH surge. Okay. So now there are two methods that can help in identifying the LH surge. One is breeding based on vaginoscopy and breeding based on hormone assays. So let's talk about ovulation timing based on vaginoscopy. So where you use a rigid endoscope, or you have a flexible fiber optic endoscope, both can be used. So I'm going to introduce it into the vagina, same way craniodorsal direction. And as I'm going to introduce it into the vagina, I'm going to look at the changes in the mucosal folds, contours, profiles, and I'm going to, based on this, I'm going to say what stage of the cycle the dog is in. Okay. Now, this is a very simple technique, very easy to perform, no anesthesia, in standing position, and it requires just a few minutes. Within a few minutes, I'll be able to assess what's happening, and I can actually give the time of breeding based on vaginoscopy. Okay. So now here on the left hand side, you have an image that shows a cut section of the vagina, where you find that during proestrus, the vagina is highly edematous and is thrown into folds, which when I'm going to view through a scope, this is how it's going to look. The mucosa is highly edematous, okay, and there is going to be a bloody vaginal discharge, and this edema is because of increased estrogen levels. Okay. Now, as this dog is moving from proestrus to estrus, what is happening? There is going to be a decrease in estrogen and an increase in progesterone. And what does progesterone do? It causes it relaxes the vasoconstriction. It relieves the edema. So there's going to be a withdrawal of fluid. Okay, there's going to be a withdrawal of fluid. As a result, the mucous folds begins to shrink. Okay, or in other words, we say shrivel. It begins to shrivel or shrink. And so, as the dog is moving from proestrus to estrus, what is happening? There is a mucosa begins to shrink. So we call this as shrinkage without angulation, wherein the contours are still rounded. I call this shrinkage without angulation period, and this is corresponding to the ovulation period. Okay. Now, the next stage is where there is going to be progressive shrinkage. So, still further down, there's still progressive shrinkage where the mucosa is thrown into folds or peaks. I call this period as shrinkage with angulation period, or in other words, crenulation pattern, which is corresponding to fertilization. So, very clearly understand, once the shrinkage begins, without angulation period, it's associated with ovulation. With the angulated period, it is associated with fertilization. Okay. So now what I do here is that my breeding strategy, how do I look at a breeding strategy here? So I do perform a vaginoscopy every alternate day. So here again, I marked in red is because when I was talking to you about sexual behavior, when I was talking to you about vaginal cytology, we kept doing it once in every 2 days because there the event was estrus, right? The event I was trying to identify was estrus. Then only I have an LH surge, ovulation. So I still have time. I'm not going to miss anything. But here you need to understand the event I am trying to identify is an LH surge. It's a very, very narrow event. I have a narrow window. So that means every day or every alternate day examination is a must. Okay. So I start from day 5 or day 7. Okay. And I go on doing it at every alternate days till I get this onset of shrinkage without angulation period. What is this period corresponding to? Ovulation. Okay. So now giving our situation, giving our dog, giving the Sandy, giving our, Sandy to breed, I need to give time to the owner to take this dog to Bombay for mating, right? So now I keep doing this examination every alternate days. And the day I have this shrinkage without angulation, which is corresponding to ovulation, I said, come on, chalo, move to Bombay and breed after 2 days and rebreed after 48 hours. So all I need is 2 matings, okay? So just breed after 2 days and rebreed after 48 hours. 100% this dog is also going to conceive, okay? So the advantages of this vaginoscopy is that it can identify ovulation or the fertilization period, and even a single mating is enough during the fertile period to bring about conception. So an excellent tool when I'm trying to breed a dog with very low sperm count, okay, very low sperm count, but still the owner wants to have a progeny from him. So I'm identifying exactly the ovulation or fertilization. I'm going to breed it, okay. But the disadvantages is that this technique is subjective, right? So what to my eyes would be shrinkage without angulation would be a shrinkage with angulation for somebody else. Okay, so it's subjective, of course. Again, as we practice it, you gain expertise in it, and you kind of you are able to work with this. Then the other disadvantage or the major disadvantage I would see in this is that the total equipment that is associated with this examination and viewing, this is going to cost me around 10 lakhs. Okay, so I can still use a pediatric proctoscope or an otoscope, but still if I'm going to need a camera attachment, viewing, because this vaginoscopy not only just stops with this, okay, so I can use the vaginoscope for transcervical artificial inseminations, for examining strictures, or any anomalies, vaginal anomalies, tumors, everything. So that means if I have this entire setup, it's going to cost me around minimum around 10 lakhs. Okay, so that's one of the major disadvantages I would see with this. So going on to our last technique, that's going to be ovulation timing based on hormone assays. Okay, so the most important hormone that is associated with ovulation is LH. So if I'm going to identify LH, so that means I know the dog is going to ovulate 2 days later. Yeah, it's okay. So that means I can assay this LH either qualitatively using kits that are available or quantitatively in a laboratory. But unfortunately, LH assays cannot be done quantitatively in laboratories for the simple reason I require an LH antigen or canine LH antigen or an ovine LH antigen, which is antigenically similar to that of canine LH. So that means our routine laboratories or human laboratories cannot estimate canine LH or even FSH for that matter. Okay. So instead, we have kits that are available that can identify the LH in the case of dogs. Now, only disadvantage are that daily sampling is required, daily blood sampling. So this is using the blood samples, you test and you look for the formation of the lines that are going to be there. Okay, so this is a rapid test and you get the result in a very fast manner. Okay, so hardly 10 minutes to 15-20 minutes. By this time, you get the results. The turnaround time is very quick. But the only disadvantage is that the shelf life of this kit is very, very short. Okay, and it needs to be imported. So the reason for, giving all these reasons, we do not normally practice, or it's not commercially viable to determine the LH surge based on these kits. Okay, So now instead, we have also spoken about progesterone. Okay. So we also know that bitches are unique in that there is a pre-ovulatory rise in progesterone prior to ovulation. Okay. There's a rise in progesterone, which is very unique to this species. And this rise in progesterone can actually tell when the LH surge is happening, when ovulation is happening, when fertilization is happening. Okay. Now, if you talk about the levels of progesterone and you associate with the events, okay, a level of 2 to 2.9 is indicative of the day of LH surge. A level of 4 to 10, which is the most important, the level of 4, it's indicative of beginning of ovulation, and a level of 10 to 19 is suggestive of the fertilization period. Okay. So whatever technique that I'm using to determine the progesterone, I try to identify the ovulation day. Okay. I don't stop with the day of LH surge because I prefer to go on to determine the ovulation day. So I wait for the levels to reach 4 nanograms, and that indicates the time of ovulation. Okay. So this progesterone can be estimated both qualitatively as well as quantitatively. Okay. Now we'll talk about the quantitative estimations at a later point, but qualitatively, we have a lot of kits that can be used to check for the progesterone levels. Okay. Now, all these tests qualitative tests I've worked with, and the most popular being this target. Okay, this target, which is again based on a quantitative or competitive ELISA binding. Okay, competitive binding ELISA binding, and here these are in fact semi-quantitative assays. That means they give color changes for a particular level of progesterone. Okay, so with this kit, so let's not go too deeper into it. All you need to understand is that when the progesterone level is low, the conjugate binding will be more. So that means the color is also more. Okay.
Hatvet Pharma introduces Heparaj Plus tablets. L-ornithine, L-aspartate 250 mg, thiamine mononitrate 1.5 mg, riboflavin 1.5 mg, pyridoxine hydrochloride 1.5 mg, nicotinamide 20 mg, calcium, D-pantothenate 5 mg, silymarin 100 mg, and folic acid 1 mg. Multivitamin supplement with the power of silymarin. Heparaj Plus tablets. Hepatoprotectant systemic drug. Indications: supplement to support healthy growth, general weakness and debility, geriatric support, chronic and acute liver disease, cirrhosis, hepatoprotective agent when hepatotoxic agents are ingested, example death cap mushrooms, beneficial in preventing certain cancers and improving the efficacy and reducing the negative effects of chemotherapy for certain tumors. Dosage: for small breeds, 1 tablet per day. Medium and large breeds, 1 tablet twice a day. Route: oral. Presentation: 1 into 10 tablets. You can book your order online at www.hatvet.com. Looking forward to a long-lasting business association. Thank you.
So when I have a low progesterone level, that I have a dark color that is going to be produced. So as the progesterone levels are increasing, the color is now going to go on decreasing. So this is just nothing at a competitive binding assay. Okay. So here what happens is, so I'm looking for a light blue color, and a faint blue color is suggestive of ovulation, and I'm going to breed the dog 2 days later, rebreed it after 48 hours. Now this is also another kit where it's called as ICG Status Pro, and here also these are all progesterone assay kits. Okay. And so where you see 3 dots that are available. So when the progesterone levels are low, you have 3 dots. And as the progesterone level keeps increasing, the number of dots are reducing, right? Okay, so this is one more kit. And the most, my favorite kit is going to be this Ovucheck Pre-Mate, right? Okay, 10, where, the color demarcation is very, very clear with this test, right? See, the initial 2 kits, it was a little tough to identify the blue, the faint blue, or is it dark blue? I mean, dark blue is okay, but this medium blue and then this light blue is kind of very confusing. But this has a very clear demarcation between dark pink color and light pink color. Okay. So dark pink color is less than 3, light pink color is more than 10. So I have a value of between these two, it is indicative of 4 to 10, that is suggestive of ovulation. So this is an excellent kit Now, the only disadvantage, it's only 10 tests. Okay, 10 tests. It's not 10 dogs, right? So that means if I start a dog today, I keep testing her on alternate days. So let's say this dog is in heat for nearly in Eastern for at least 20 days. So imagine the number of tests that I will be using for this dog. Okay. Now this is the disadvantage with all these kits. Okay. So the number of tests for these kits are going to be very, very less. Okay. So this is also another kit which is called as a K9 Progest kit, and this is based on color changes similar to the previous one, Overcheck Premade. And here the color changes are blue in color. Okay. So anyway, to me, the major disadvantages with this qualitative or advantages, if I say, would be the turnaround time will be very quick. Okay, within half an hour, I would get the results and I will be able to say, okay, now this dog is ready. Now you can move. Now you can transport your dog. Yes, and you can breed her at 20 within 24 hours, rebreed after 48 hours. So these are things I can suggest based on these kits. Okay. Now, only disadvantages, these kits are not available in India. They need to be imported. So the other alternative or the best alternative for you is to go for quantitative assays. Okay. So wherein the progesterone, you can collect the blood samples, either the serum or the plasma samples can be collected, and you can give it to your laboratory. Okay. Where the progesterone can be tested by RIA, ELISA, or by CLIA, and there the turnaround, they would give you the results within a period of four hours, the same day. So that's the thing. And the most important thing you need to understand, any human laboratory can check for these progesterone assays, because progesterone or in fact steroid hormones are not species specific. Okay, so I can go for any of these techniques to get the results. Okay, so let's talk about our dog Sandy. Okay, let's say on day 7 I'm collecting her blood sample. I'm looking for a progesterone value, and the progesterone value comes as 0.91 nanograms per ml. Okay, now on day 9 again I collect the sample, it's 0.89. So you find a decrease here, 0.91, 0.89. Don't worry about all this, because this is just a pipetting error, it's a very margin thing. Don't worry about this. Keep taking the samples every alternate days. Okay, so day 11, I'm doing another sampling. I now find a small increase, 1.02 nanograms per ml. By day 13, it goes to 3.41 nanograms. By day 15, it reaches 4.64 nanograms. By day 17, 8.22. By day 19, it reaches 11.45 nanograms per ml. Okay. So now, which two breeding dates would I suggest for this particular case? Okay. I've given you a series of values. Now, which two breeding dates would I suggest? Now, giving you all these data, okay? Now, this is the day of ovulation. Day 15 is 4.64, which indicates that this dog has started to ovulate, okay? So now what I do is, I will not in fact take day 17 sample and day 19 sample. All these values are just to confuse you actually, okay? So by day 15, once I get a value of 4.64, okay, I know ovulation has started. I tell the owner, yes, now this is the time to move to Bombay. Okay, take her, breed her on day 17 and rebreed her on day 19. Okay, so breed her 2 days later and rebreed her after 48 hours. That means breed her on the 19th day. So this is my breeding strategy. 100% this dog is going to conceive. Believe me, I know a lot of people in the north, you're breeding your dogs based on progesterone assays. I know you're following this, but I still find a lot of people, there's a variation in the breeding dates they suggest. So very clearly, please understand, you're identifying ovulation, breed it 2 days later and rebreed it after 48 hours, period. That's all you have to do, okay? So now, given you all these 4 options, I think the best option for you to do under the current situation where you have limited number of matings and you have the location of the male, progesterone assays or quantitative progesterone assays are your best tool for breeding management. Okay. Now, the only disadvantage with this is that you need to have a turnaround. That means you need to work with your lab and you should be sure that the lab is able to give you the results the same day. Okay. There are so many situations where the labs collect samples for a period of 1 or 2 days and they give the results after 3 days or the 4th day, which is not going to work for your case. Okay. So you need to have a daily sampling. The results need to come the same day. And there again, it's important that you work with your lab and honestly tell them that these are canine samples And there is a possibility that you can have a value of 20 nanograms, 40 nanogram, 80 nanograms, which you will not see in a human sample, right? Okay. So I don't want the lab to think there's something wrong with this assay and give you a wrong value, okay? Or maybe cook up a value or work out of the value. So most important, tell him that these are canine samples. There is a possibility, and you talk to him about the ranges also, okay? There is a possibility of so low range also, it can go up to 80, 90 nanograms, right? Okay. So as I said, this is an excellent technique. And the only disadvantage again is that I'll be doing a daily sampling, on alternate day sampling. And for a lab, for Chennai, it's I think it's cheaper when compared to the north. In Chennai, they charge around 350 rupees for each sampling, but I think in the north it's more than that. Okay, so every sample, this owner is going to spend 350, 350, 350, and not including your charges. Okay, as a doctor's charges fees is not including that. So when he's going to go on spending, he's going to say, "Doctor, I will not be able to check so many samples." I've had so many clients doing this to me, right? Okay. They will start off and then they will say, "Doctor, there are too many samples. Can I start breeding the dog? This dog is already standing with the male. Can I start breeding the dog?" So you need to talk to the owner before you do all this. Talk to the owner. Tell him, "I am trying to identify ovulation. Okay. This bitch will be standing for the male. She may be receptive for any male, but that is not what we are identifying. We are identifying ovulation. So there is important that an alternate day examination and a progressive examination is a must." Okay. Now, I would actually talk to you about a small case, which recently I just, dealt with it around last week, I think. So this person comes from Bombay, and yeah, it's a Doberman, right? And the bitch was 6 years old, and his owner says, "I've come all the way from Bombay," and he's gone to Nellore for mating. And unfortunately, what happened is this male that they have selected is a 10-year-old male, and he wants to have puppies out of these two. Okay. And what happens is, now he says he's tried mating with these two, and then the male could not actually mate at all. Now, this guy has started from Bombay when the progesterone values are 6. Okay. So that means he should have mated the dog almost 1 or 2 days later. Okay. But he's coming to me nearly 6 days later. And I tried explaining to him that by this time, there is already a possibility that there will not be any eggs available. And there is very, very low chances that your dog is going to conceive. Okay. Now he said, "No, ma'am, it's okay. Having taken the chances that I came all the way from Bombay, I don't mind going ahead with the insemination." So clearly, please tell your client that there is no kind of way that you can say, "Okay, I'll take 2 samples now, then let's leave it for another 2 more days, and then again we'll take another sample later." So just don't do that. So most important, alternate day sampling is a must. If the owner feels that it's expensive, then you can combine cytology with your progesterone assays. So what you can do is you can start taking your cytology smears, keep doing it once in every 2 days until you get 60% of superficial and conified cells. Once you reach 60% superficial and conified cells, now start collecting your blood samples and keep checking for the progesterone values till you reach 4 nanograms per ml. So now you transport the dog if required, breed it after 2 days, and rebreed it after 48 hours. By this way, you can actually reduce the number of progesterone samples that is required for the dog. Okay. So this is excellent protocol. So here, the slide you see, I kind of, you have a Neapolitan Mastiff with, I think, 19 puppies. I think that's a maximum litter I've seen. I never failed to put this in my slide. And some of the puppies actually passed away. They couldn't maintain all the 19 puppies. But why I put this slide is to show that this dog was mated based on progesterone estimation, and you had a very big litter size. The litter is not because of progesterone estimation. The litter is because you managed to cover almost all the eggs during this period of time. Okay. So your take-home message from this is that no one test will pinpoint the breeding time with absolute accuracy. Okay, you need to utilize as many diagnostic tools as possible. And it is important to understand the benefit and limitations of each diagnostic tool before you use them. Individually, the information they reveal is limited, but when used in conjunction with each other, according to a diagnostic plan, they can accurately identify the fertile period. Okay. So I would like to close off my sessions with 3 important kind of, questions that people normally ask, and I try to answer them. Thus, breeding on different dates results in the birth of puppies of different gestational ages or sizes. Okay. So I have a lot of vets telling, oh, you've mated your dog so many times during the heat period. That's the reason why you have one puppy which is big and one puppy which is small. Now, is that true actually? No, it's really not true. You need to clearly understand that even though ovulation happens on different dates, fertilization is going to happen on different dates, the developmental competence of the fetuses are synchronized so that all the fetuses are of the same gestational age when they are born. Okay. So the difference in size is not related to the different mating dates. It's mainly probably because it's associated with that individual puppy, the genetics of that puppy, the amount of blood supply that goes to that particular puppy, the placental development, everything is related to the individual. Okay, so it is not related to the different mating dates. Okay. Now, are vaginal cultures required prior to breeding bitches? Okay. Now, I had a person or I had a breeder from coming from, I think, from, um, if I'm somewhere from the north, for that matter, and he said, he's done, and he's been doing a lot of tests. Every time this dog comes into heat, he's been doing vaginal cultures. He's looked at it, and every time this dog is having a positive culture, he goes on for antibiotic therapy, and this dog is not conceived. Okay, you need to understand that without clinical signs or a history of reproductive dysfunction, vaginal cultures are usually not indicated. Okay, so anytime you take a swab from the bitch or from the prepuce of a male, there'll always be a growth of organisms present. Okay, so that means there's nothing that you take a culture, you do an antibiotic sensitivity test, and then you don't do what is called as a uterine douching. You cannot enter into the, or you cannot catheterize the uterus as you do in other species. It's not so easy. I'm not saying it's impossible, but it's very, very difficult. You need, if you want to catheterize the uterus, you need to have an endoscope guided catheterization. Okay, so that means you're not doing a uterine douching also. So all you're doing is a vaginal wash. So all this is not required because for the simple reason, organisms that are known to cause infertility, abortion, stillbirth, or neonatal disease, all these, okay, caused by herpes virus, brucella canis, minute virus of canines, mycoplasma, ureoplasma, all these are difficult to isolate with your routine culturing procedures. So there's no need for you to do cultures. There's no need for you to put the dog onto antibiotic coverage unless and otherwise you have certain issues or abnormal discharges that are required. Okay. So, can we breed a bitch during the first heat? Okay, a lot of time people come and ask you. I said, no, we tell the owner, no, your dog is coming into heat, don't breed her now, breed her after, during her next heat. Okay, so this is because the incidence of silent heat or split heats are more common with the onset of puberty. It's not that this dog has not attained her maximum growth or she cannot produce any. There are so many cases where the dog in the first heat has been mated and she becomes pregnant also. Okay, normally we avoid breeding them because incidence of split heat means a dog will have one cycle has been split into two halves. Okay, so the first half will be an anovulatory estrus. She'll come into heat, you'll mate her, but she may not ovulate at all. Now 4 to 8 weeks later, once again the dog will start coming into heat. Okay, so this we call this as a split heat. So the incidence of split heat or silent heat is more common with the onset of puberty. So therefore, we wait for the cycle to set into a regular pattern, or we start breeding her from the second heat. Okay. So ideal breedable age is between 3 to 6 years. Now beyond 6 years, we don't breed the dog because once again the incidence of uterine infections, the number of ovulations that are going to be is higher. Ovulations is going to reduce. Number of absorptions, they're more common as the dog becomes older. Okay. So with this, thank you so much. And I would like to say, be responsible, stay safe. And I would like to see you next time in December 6th, 2020, with my next series of lectures, which is going to be on canine pregnancy and parturition, where I will try to take you through pregnancy diagnosis, its challenges and techniques, care and management during pregnancy, prediction of parturition, and care of newborn. Thank you, everybody. Thank you so much.
Uh, Thank you, ma'am. Dr. Anju Singh will join soon. Just wait, ma'am.
Hatvet Pharma Private Limited is a pharmaceutical company with its head office at Meerut. It was founded on 29 January 2019 with a vision to provide affordable and quality veterinary medicine to our pet parents. Hatvet Pharma is doing marketing of veterinary pharmaceuticals throughout India. In a small span of 1 year, we have launched 51 products in the veterinary pharma industry to serve our clients. In future 1 year, we are planning to have a product basket of more than 100 products. Hatvet is different from other veterinary pharma companies as we don't have distribution channel. We understand the latest needs of market, and for this reason we have adapted to online module of selling our drugs to field practitioners. We are serving our clients by providing the required medicines at their doorstep without any middleman. We directly collect orders online, mobile app, WhatsApp, telephonic from our end customers, and we deliver the required products to their doorstep through our nationwide logistic partners Blue Dart, DTDC, TCI Express. We are happy to announce that in our client list, most of the leading pet practitioners of India are included. To assure the unbreakable faith of our clients in our company products, we look after the quality of products, starting from selecting the raw material for our final products, aseptic precautions during manufacturing, and proper storage of finished products till supply to the end customers to ensure quality of products. We are happy to share that Hatvet Pharma has been recognized at various business platforms. Recently, an article on Hatvet Pharma has been published in the leading business magazine Business Connect. One more milestone in the success story for Hatvet Pharma is that the managing director of the company, Dr. Rajneesh Tyagi, has been awarded Young Asian Entrepreneurs Award at Bangkok, Thailand on 7 February 2020. Our vision states Hatvet Pharma to be a commercially viable leading veterinary pharmaceutical company in providing quality products affordable to various sections of the pet owner society. Our endeavor is to be a front runner in innovation and quality in the veterinary pharma industry. We see a very bright future for our company as we are working in pet industry, which itself is growing at a higher rate, approximate growth of 20% annually. We are regularly working on the knowing of needs of our customers to serve them in a better way. We value your support to Hatvet Pharma and are very thankful to all of you. We look forward for a very strong and long business association between veterinarians and Hatvet Pharma. Thank you.